All right, today we're jumping into a pretty incredible challenge that's happening right at the frontier of surgery. You see, thanks to modern medicine, folks on hemodialysis are living way longer than ever before. But that success has created a whole new problem. Their bodies are literally starting to run out of options for the very treatment that's keeping them alive. Yeah, and this isn't some far-off hypothetical. For thousands and thousands of people, this is a real life-or-death situation. Their veins, which are the absolute key to getting dialysis, are a finite resource. So what in the world do surgeons do when they've just run out of road? And this is not some rare thing, you know? The data shows that almost 7% of all new dialysis access procedures are now considered complex. And what that means is surgeons can't use the normal spots in the arms anymore. They have to get really creative, moving to places like the legs, the chest, even the abdomen. So why is this even happening? Well, it's kind of this strange paradox of success. The better the care gets, the longer patients live. But that long-term treatment means they start to use up all of what surgeons call their vascular real estate. Think of it like this. The veins in your arms are like these major superhighways. For someone on dialysis, every single treatment is like rush hour traffic. And over years and years, those highways, they start to get potholes, scar tissue, blockages, and eventually they just close down for good. And the surgeon is left staring at a map where all the main routes are gone. Now, you might be sitting there thinking, okay, why not just use a long-term catheter? Well, it's just not that simple. I mean, sure, a catheter is a plastic tube that can be put in, but it carries a huge risk of infection and a ton of other serious complications. The real goal, the gold standard, is to create a durable, surgically made connection between an artery and a vein. That's called an AV access, and it gives a much better quality of life. A catheter, that's truly the last resort. And that's exactly why surgeons don't just jump straight to these really complex procedures. Nope, they follow a very careful, very methodical strategy before they even think about trying to build a new lifeline in some unconventional spot. First, they basically become detectives. They dig into the patient's entire history to figure out why every previous attempt failed. Then, they become map makers, using super detailed imaging to create a complete roadmap of every single remaining vein. And it's only after they've confirmed that there are absolutely no standard options left in the arms, only then will they consider one of these complex procedures. So what are the solutions then? Well, the first major approach is to look inside the patient's own body for spare parts. This whole category is what's known as autogenous access. And this brings us to a really crucial decision point. Using the patient's own vein, autogenous access, is always the best case scenario. It's way more resistant to infection, and it can last a lot longer. But what if there are no good veins left to use? That is when surgeons have to turn to prosthetic or man-made grafts. And a really brilliant example of an autogenous solution is something called the femoral vein transposition. Honestly, it's like borrowing the spare tire from the trunk of your car to fix a flat. Surgeons can actually take a large vein from the patient's thigh and move it or transpose it, so it's sitting right under the skin, ready to be used for dialysis. It's amazing. Now, this is where you can really see the incredible high-wire act that surgeons are performing. On the one hand, you have this fantastic 94% patency rate at 2 years. That means it's still open and working. Awesome. But on the other hand, there's a really serious initial risk in almost a third of patients of cutting off blood flow to the limb. It's a condition called ischemia. It's a huge, calculated gamble with absolutely life-changing stakes. So what happens when using the body's own spare parts just isn't an option anymore? Well, that's when surgeons have to become engineers, using man-made materials to build a new solution basically from scratch. We're talking about prosthetic grafts. They're usually made of a material called PTFE. The best way to think about this is that the surgeon is literally building a brand new bridge to connect an artery to a vein after all the natural bridges have washed out. And they can build these bridges in some pretty surprising places. The most common are thigh loops, where a graft connects the major vessels in the leg, or even chest wall grafts that can loop across the upper chest, almost like a necklace. But again, we see that incredibly difficult choice that surgeons have to make. A prosthetic thigh loop? It's a simpler operation, which is a huge plus. But the risk of infection is unbelievably high. Some studies have reported rates up to 41%. I mean, that is a constant and a very serious worry for everyone involved. But what if the problem isn't just a local vein? what if there's a total roadblock on the main venous highway leading back to the heart? This is where innovation gets to a whole new level. The Hero Graft is this hybrid device, and it's designed for that exact problem. It's part graft, part catheter, and it just bypasses the blockage entirely by creating a direct line from an artery in the arm all the way to the right atrium of the heart. Just incredible. Okay, now we're arriving at the very edge of what is medically possible. These are the exotic procedures. This is the last resort, when every single other option, even the other complex ones, has been tried and failed. Take this one, for instance. It's a prosthetic graft that runs directly from the axillary artery, that's the one up in your armpit, all the way to the right atrium of the heart itself. It's a direct, man-made pipeline to the body's central pump. Or how about this? An arterial-to-arterial loop. I mean, this procedure just completely bypasses the venous system altogether. Surgeons create a loop using only high-pressure arteries, a technique that was once just unthinkable. And for the grand finale, there's the inside-out technique. This is mind-bending. If a central vein is totally blocked, surgeons can guide a wire from inside the heart, push it outwards through the blockage, grab it from under the skin, and then use that brand new path to place a catheter. It's just an astounding feat of surgical navigation. And this quote from the source material, it really just says it all. These are not routine operations, not even close. They are acts of pure surgical creativity, reserved for the most desperate situations, when a patient has truly run out of road and this is the only thing standing between them and the end of their treatment. So, what's the big takeaway here? Well, as patients live longer, they are literally outliving their traditional lifelines. And surgeons don't take this lightly. They have a very deliberate strategy, constantly weighing the pros and cons of using the body's own parts versus these man-made solutions. Every single option involves this delicate, high-stakes balance of incredible benefits and very, very serious risks, pushing surgical innovation to its absolute limits just to sustain life. And that leaves us with one last big thought. We've just seen how surgeons are working at the very, very edge of what the human body can endure. So as medicine continues to get better and better at extending life, the bigger question becomes, how will surgical creativity continue to innovate and keep pace with the body's ultimate limits?